Dr. Kang, it's great to see you again. How have you been this past year?
Hi, Jonathan. Thank you for having me back. It's lovely to speak with you. What a year we've had. Well, I will say, being a mental health professional, a physician in this pandemic, has been very challenging. We certainly have heard a lot about the infectious disease part of COVID-19, and I think the mental health piece is really unfolding. I see it in my practice. I see it in my colleagues, in my friends, my family, and my community. So I think this is great that we're having this conversation about music and medicine and its empowering ability to uplift our brain and our well-being. How have you been? I thought of you and how quickly you adapted when this all first started. You were one of the first people I knew who said, let's just do this online and let's keep it going.
I'm doing okay. I think we've adapted in a really great way here, partially because we'd already had an infrastructure set up from several years ago for being able to broadcast concerts and to do live stream. So the transition wasn't quite as chaotic for us, and it was a natural one to have made, but I think a whole year later, we're still seeing many of the challenges that we had at the beginning. But first of all, I want to just thank you so much for what you said last year. And I really appreciated the advice that you gave us at the beginning, which turned out to be spot on. You mentioned that creating music and art, getting into nature, you spoke about breathing mindfully, keeping in touch with people as best we can, and moving as much as possible. I know that many of the students here at the School of Music have been trying to take into these suggestions that you gave us. I really enjoyed what you said last year when you were speaking about music as medicine and how the act of listening to or creating music is hardwired to help us with our mental health. I'm wondering if you can speak a little bit more about how you've seen this idea develop during the past year.
Great. Yes. So all of the things, first of all, that you mentioned, the nature, movement and staying connected, all of those things are powerful natural antidepressants. They're also powerful natural brain optimizers and lead to peak performance, right? So musicians are performers. And so these are great things, not just for your mental well-being, but for your peak ability to perform at the highest level. It's what gets us into flow states. When you hear of flow, this is peak performance science. The breathing, the connection, the gratitude, really having, going inwards and focusing and doing one thing at a time and having your mind on your performance, all of those sync up and we get our brain into these amazing states, and we can get into even what we call gamma waves, which is fantastic. But to answer your question, music has always been, I think, a powerful tool of human culture. It is something the human brain and body evolved in tandem with music. And when we look at hunter-gatherer society and indigenous cultures, and then the evolution of music across the world, wherever we go, there is no place on earth that music has not been part of the human fabric. And that is because music and neuroscience are linked together. It is the rhythms, it is the voice, it is the patterns of sound. Whether it started in nature with a waterfall or, with a piano, these patterns of sound are familiar to our brain. They relax our mind. They release endorphins, very powerful neurochemical of bliss and peace. There is very strong scientific evidence about music and endorphin release. We are using music as therapy for serious mental health issues. It is one of the key pieces in our toolbox, along with cardiovascular exercise and powerful medications. So there is no doubt music is medicine, and it is a brain optimizer, and it leads to peak performance for all of us.
That's a fantastic answer. Music is medicine. our students at the UBC School of Music have been able to play music in person in a very limited way. And we've all been keenly aware of what a privilege it is to make music together. And we talk a lot about the fact that in rehearsal, we're cherishing every moment now, right? We're thinking about how we can maximize our experiences together in creating music to make sure that we're looking at each specific time that we have to make music together in a way that really feels as if it's not about the final outcome. It's about what we do in the present. Now, all this being said, we're extremely eager to be able to have a chance to perform for people again. And I think that it's a challenge for musicians, for other creative artists who are looking for a response from an audience. And I'm wondering what advice you might give to these artists who are struggling for not being able to have that reciprocity with an audience right now.
Yes, definitely. You know, I'm not a performer, but I am a human, and I know how important it is to be, you know, in real life social connection. We are social beings. That is how we are meant to live, in groups and community and social bonding. So I can't imagine how difficult it's been for the musicians who, you know, who love to perform with real live audiences. I would say, though, that we know, thankfully, that actually technology can help us, you know, in this process. In the meantime, studies show that communication and music through technology like video conferencing, like now, can still release oxytocin, that neurohormone of bonding and trust. So, you know, whether you can't see it, your audiences are still getting that benefit. And I often tell people that prior to a performance, if you can't see your audience, then the tool of visualization is actually really powerful. So I have a little technique, and I say, well, first of all, regulate your own stress. Take a couple of nice deep breaths, get those receptors in your lungs nice and stretched out. That sends a signal to your brain that you're okay. You can move out of any stress adrenaline response right into you know, a growth nervous system. We call it the parasympathetic nervous system. So a few minutes of breathing prior to a performance is fantastic. And then close your eyes and visualize your audience. Try to imagine their faces, their bodies swaying with the music, whatever feedback you're used to. That actually puts a slide into an area of our brain, a very deep area. I actually have a brain right here, a very deep area called the reticular activating system. And that tells our brain what's important and what to pay attention to. So that goal, that visual goal, will allow your brain and body to now sync up. It will literally get your fingers moving the way you want them to move, or your voice in your windpipes, or however you're performing. And you're basically giving your neurochemistry the goal. And so that act of visualization, and then with gratitude for yourself, and with a moment of feeling grateful for yourself for giving this performance, and to the audience that's listening, to this sense of connection. That activity, it might take 3 minutes, 4 minutes, you can prolong it if you want, will give you endorphins and oxytocin and some serotonin there. It's great for you. It'll enhance your performance. And I hope it's something that you can all try, because I think it's very powerful and helpful.
I think that's a great summary of some of the things that we can do, because I know that there are many that are struggling with this right now. I wanted to ask you if you could talk a bit more about what you describe in some of your writing as the importance of play. I can definitely see connections for how that works for musicians. We talk about these types of experimentations and rehearsal, but I'm wondering if maybe you can expand that and help someone who's listening to the concerts, help them think about how that important aspect of mental health could be a great tool for them.
Right. So Jonathan, play is one of my favorite topics. You know, my first book was called The Dolphin Way. And in that book, I talked about 3 sacred human activities that we have forgotten are so important for our brain and well-being and our peak performance. And these 3 activities are play, others, social connection, which I just mentioned, and downtime, the breathing, the gratitude, the mindfulness, which I mentioned. So let's talk about play. All animals in nature, and in fact, the more sophisticated the animal, the more we see play behaviors. So dolphins play every day, polar bears play. Humans are meant to play. And what that means, it's a mindset of trying new and different things, being comfortable with mistakes, letting go of perfectionism, and just stepping into the unknown. When we participate in any kind of play behaviors, whether it's with your instrument or your body, you're going to try some yoga or go hiking or a new dance move, or how you do the dishes or cook your meal. It could be anything. But when you approach that with this mindset, I'm going to play, I'm going to be comfortable with mistakes, I'm going to learn from trial and error, which is the scientific method. Now we are opening up this area, this prefrontal cortex, this very sophisticated part of our brain. Play is how we adapt. Play is how we develop new pathways and innovate. So, my message to all musicians and everyone is to let go of perfectionism, step into the unknown, try your best to be comfortable with mistakes, learn from trial and error. And if you can be in that moment and be in that play mindset, now you will move faster in your adaptability and your innovation, and also in your performance, because it also leads to that peak performance skill set that I mentioned earlier.
Thank you so much for sharing all of your wonderful insights into how we can think in a really positive way right now, and to harness the power of music to help with mental healing during this difficult time. Thank you so much, Dr. Kang.
Thank you, Jonathan. And, I appreciate all your efforts, incredible leadership at UBC to keep the music going. Music is medicine. It is a prescription. It is free in general and no side effects. And you will definitely get those endorphins and oxytocins and serotonin and dopamine, all those amazing things. And thank you for all your contributions.
Thank you.